Okay. Welcome, everyone. This is Mayor Steve Haggerty, and you are joining our coronavirus Q&A series with a focus on vaccinations. I'm delighted to have with us today two doctors, Dr. Martin Siglin, who's with Amita Health, and Dr. Siglin has been on this series before, and Dr. Muthaya, who is a epidemiologist who focuses on infectious diseases at North Shore University Health System. So welcome to both of our doctors that are with us today. We're also going to have our public health director joining us, and that is Ike Ogbo, who has been leading our community efforts towards this pandemic. We have more questions asked today than we have on any of our series. And so rather than give a background and an update on what's going on with the virus here, I want to get right into the questions that residents are asking. One question that I will just answer is that a few folks have said, hey, are we going to transcribe this into Spanish for our Spanish-speaking residents? And the email that I saw this morning, we are going to hold a similar coronavirus Q&A like we did this summer on a different topic that will be in Spanish. And we will have some Spanish-speaking doctors with us and a facilitator, not me, who can speak fluent Spanish with everyone. So that will be coming. So let's go ahead and just get started. Again, have a lot of questions, so I'm just going to ask our panelists that we be concise with our responses so we can try and get through them. And then I'll direct these to each of the doctors. And then if you really want to chime in on something, on a particular question, just raise your hand. I'll see it, and then I'll call on you. Otherwise, I'm going to flip the next question to the next doctor. So I'm going to start with Dr. Muthaya with this question, which we've heard from plenty of residents, is how common are allergic reactions to the vaccine? And what procedures will be followed to monitor recipients for reactions and provide appropriate interventions?
So that's a great question. Allergic reactions, severe ones, are rare, but they do occur. They have not, in our experience at North Shore University Health Systems, happened once in now almost 17,000 vaccinations. So I would say they're very, very rare. If they are to happen, they most often happen in people who have a history of allergic reaction to vaccines or medications. So I would say that they're rare. Still, in spite of that, we're prudent. So in our health systems and others, we have folks stay for observation for at least 15 minutes and sometimes longer if there's a history of allergic reaction, to be observed and monitored with the appropriate healthcare personnel around should there be any severe side effect. I believe the same precautions are being taken at the city level.
Yes, so thank you. So the city has points of distribution where vaccines are being administered, and there is when you have it, they ask you a series of questions before you get the shot, as the doctor talked about, and then they are putting you in a waiting area for 15 minutes afterwards to make sure that you don't have any reaction immediately after, and if so, we have medical professionals there to help with that. I should mention, we've put these questions into two categories: vaccine safety and effectiveness, which are mostly going to be directed towards our doctors, and then planning and distribution. Lots of people are asking those questions about, hey, I'm 80 years old, why haven't I gotten the vaccine yet? My friend in some other state or some other city already has. We're going to answer those questions a little later and make sure everyone understands that process. So Dr. Siglin, let's go to the next question. How were vaccines developed so quickly, and how do we know they are safe? And I think we've had this question before, and there's just people concerned that we so quickly develop the vaccine. Can it possibly be safe? If you could just alleviate those concerns or share a little, I think that would be helpful.
Sure. It's understandable there was such an urgency to get these vaccines out that people are concerned that there were shortcuts taken. And there really weren't shortcuts taken. What happened is they did different phases of the vaccine testing at the same time in parallel, as opposed to doing them one after the other. The mRNA vaccine, while it's a newer type of vaccine, has really been under development for 5 or 10 years. There's been a lot of work going on behind the scenes. It was used with Ebola and others. So it's really been in preparation for quite a long time. And the process itself makes it capable of developing quickly the vaccine as needed. So there are different types of vaccines that are being used. The mRNA that came out first is because it's something that could be done in the lab and it's amenable to rapid production. And that's why it's been in research for 5-10 years and development, because this does allow it to come out more quickly. And in the future might even allow us to do multiple vaccines in one dose. So there were no shortcuts taken. The safety data is there, the efficacy data is there, and we know that they work and they are safe. So there should be no concerns about this at this point.
Thank you, Dr. Siglin. And I'll tell you what alleviates my concern. Like you said, they're using, frameworks and foundations of science that we have been using for a long, long time to develop the vaccines. But I get some comfort in the fact that all of these different countries who have their own independent medical boards are reviewing this, independent of each of the countries, and are blessing it and saying, yes, this is safe. And so the fact that, Germany does, and England and France and Canada and the US, that gives me some comfort that this vaccine is safe, because it's reviewed by medical professionals from all of these different countries.
And in our country, the FDA and the CDC have looked at these very closely, and they have to get approved by these organizations who are not taking it lightly.
Thank you. Dr. Muthaya, can I spread COVID-19 after receiving both doses?
So as far as we know from the studies that have been done, we know that the 2 approved vaccines prevent symptomatic COVID infection. And we know that they can also prevent COVID infection to become more severe, meaning that if somebody still gets the virus, they're less likely to develop a severe course. What we don't know, and what's still an outstanding question that's being studied still, is whether somebody can be an asymptomatic carrier of COVID and then pass it on to somebody else, even though they've been vaccinated. So that answer is still awaited, but people are continuing to explore it. And until then, the assumption is that COVID can still be spread even after vaccination, which is where masks become important in this toolkit, as they have been up until this point.
Right. And so we are all still going to be required to wear our masks for some period of time while they continue to do studies, even after we've had the vaccine. And so that's important for all of us to know. Dr. Siglin, how quickly will I be protected after receiving the vaccine?
So the studies for both Pfizer and Moderna products showed the same thing, and that is that protection starts about 14 days after your first injection and your first vaccination. So that's the start of your protection. Full protection is 1 to 2 weeks after the second dose. If you just receive 1 dose, you'll get 50 to 80% protection, but it's not really adequate, and lately they've been saying 50. So really you want to get both vaccination doses, and a week or 2 after the second vaccination, you will have your 94 to 95% protection.
Okay.
And the fact that it's 94 to 95% is another reason to be wearing masks, because there's 5% that still are able to get the illness. So masking, social distancing, hand washing, all these different factors still remain important.
So this isn't on our sheet, but I'm just going to follow up with this question. A recent concern that I've heard from folks is with these new variants that are being discovered, whether over in Europe or South America, is the vaccine still effective against those variants?
The answer is,
Dr. Sigmund.
yeah, the answer is yes from what we know so far. So Pfizer has tested against variants and said that their vaccine is effective. Moderna is double checking that as well. But in order for the vaccine not to work, the variant would have to make major changes in its spike protein. And so far, the variations in the spike protein are minor. They're not enough that the vaccine won't cover, because the vaccine covers multiple aspects of the spike protein. So, so far it looks like the vaccines will work, and it's not a concern. We should continue to get vaccinated. And if they find changes, then they'll adjust the vaccine.
So that's positive news. And I know Dr. Fauci said yesterday in a news conference that if the vaccine is less effective against some of those variants, it shouldn't be too hard for scientists to make the modifications to the vaccine to protect against those variants. Dr. Muthaya, I don't know if you have children, but I have two children, and they are under. My daughter is 17, my son is 12, but under the age. And so there's lots of questions out there if they're working on a vaccine to vaccinate children, and if so, what the progress of that vaccine is.
Yeah. So as it stands right now, that is still very much an outstanding question. As far as the two vaccines that have been approved, the Pfizer vaccine is approved for persons 16 years and older. So it does catch quite a bit of our adolescents. But the studies in children still to be determined. Hopefully by the end of the year, I'm told we should have some idea of what's in store. But beyond that, more to come.
I'm going to ask you this question, Dr. Muthaya. Does the vaccine have the preservative thimerosal? I don't know if I pronounced that correctly. And this is a question from Rena.
So there are no preservatives contained in either of the two mRNA vaccines that have been approved. And one place where you can actually find a list of all the ingredients on both vaccines is through the CDC website, which includes every ingredient, but preservatives are not included in that. Excuse me.
Okay, great. Thank you. Dr. Sigmund, once both vaccine doses are given, and I think you answered this before, but this is a question that Deborah had asked us. How long will antibodies last? No, we didn't really answer this before. How long will antibodies last before vaccination is needed again? How often can vaccine boosters be safely administered? So what you talked about before is you're not really fully protected at the 95% confidence level until after you've gotten the booster shot. And really then it's probably a week or two after that your body's really absorbed it. But here it's saying, how long is this vaccine good for? And, what's the thinking down the road for how frequently we may have to be vaccinated? Or can we just get boosters, or is it going to be 2 shots again and all of that?
So, clearly the vaccines haven't been out and being administered for more than a couple months at this point. So the feeling from the companies and the scientists right now is that this will be an annual booster, that the effect will last a year. There's some data from the vaccine companies that the antibody response is better to the vaccine than it is to the disease. So your protection from the disease might be, 3 months or so, but the feeling is from the disease, it's 90 days, from the vaccine that it should be about a year. So we'll know more at the end of the year, and we see how people are doing, and they can study individuals who have been vaccinated, but that's the going assessment right now.
Right. So the going assessment is this could become like the flu shot that you receive annually to protect you against this virus. Dr. Muthaya, we had a question from Raphael. If you have already had COVID, is it recommended that you get the vaccine? And if so, is there a waiting period between when you've had COVID and when you should get the vaccine?
Sure. So this kind of relates to some of the questions that were already asked, or the answers that Dr. Sigmund posed. We don't know how long natural immunity lasts to a COVID infection. And because we know that COVID reinfection can occur, the recommendation is that even if you've had COVID before and you have recovered, you should still get your vaccine based on where you are in that priority group. The only stipulation that has been made is for people who have received convalescent plasma or monoclonal antibody therapy for their COVID infection. Those folks should wait 90 days. Mm-hmm. And if there's any question about the timing of your vaccine, I would encourage you to, reach out to your various health care providers, health systems, or the departments of health.
Okay, great. We had a question from Linda that came in, and I do want to remind any of our viewers right now, if you have any questions for the doctors or our public health director, Ike Ogbo, just go ahead and put that question into the Facebook comment page, and Patrick Degnan, our Chief Information Officer, and his staff are monitoring that, and they're feeding questions to me. So we did get a question from Linda. Can you take an antihistamine to minimize chance of allergic reaction? How about Dr. Siglin?
The recommendation currently is that you don't pre-treat yourself prior to your vaccination, that you don't take an antihistamine, decongestants, etc. We really want to watch for any kind of reaction, and that could interfere with our ability to detect an allergic reaction developing. You have in Evanston, you're using paramedics to watch folks, and nobody has died from these vaccines. The acute allergic reactions are 11 per million. It's very rare. So the recommendation is not to pre-treat yourself with any medications for allergy.
Great, thank you. And Dr. Muthaya, we had a question from Pat. How much leeway is there in the waiting period between doses? And I know it's different depending on the manufacturer. If you could talk to people about that.
Right. So again, both the approved vaccines, Pfizer and Moderna, require 2 doses. For Pfizer, we should wait a minimum of 21 days. So the second dose should not be administered prior to 21 days, should only be 21 days or after. With Moderna, the doses are 28 days apart. Again, not to be given before 28 days, but it's okay to be given after. The strongest recommendation is that you do everything in your power to get your second dose. Remember, you are not fully protected without both parts of the vaccination series. There is some leeway with the time for the second dose, meaning you can, if it's delayed, it's probably okay. But my strong recommendation would be to put a date on the calendar, show up for that date, and get it as scheduled.
Okay, great. I know it's on the minds of many people. Are there other manufacturers that are close to getting their vaccines approved and thereby increasing the quantity of vaccines that would be available to Americans and people in other countries? Do either of you know sort of what the status is of the other vaccines that are under review and when those may potentially make it onto the market?
Johnson & Johnson is planning to go to the FDA for emergency use authorization in February. So they are geared up, they're providing their data, and they're hoping to be able to be approved next month. And they have a great supply of vaccines. So that's looking very positive. I'm not sure about AstraZeneca. I don't know if Dr. Muthaya knows about the other vaccines.
That was my understanding as well for the Oxford AstraZeneca, was that we should expect some update in February.
Okay.
So I think they're not too far behind.
Okay, great, good. Dr. Muthaya, Jennifer had a question. Will antibody testing prove that the vaccine worked?
So this is a good question, and one that scientists are still exploring. Not everybody will develop a detectable antibody after getting the vaccine. So meaning if you decide to get your vaccine and just out of curiosity want to see if you have antibodies, that's not always going to be the case. That does not mean that you're not protected. It just means that you might not have detectable antibodies. So unfortunately, at this time, we can't make a correlation between a serological test or a blood test for antibodies and whether or not somebody, did not respond to the vaccine. Great.
Dr. Siglin, do you want to add something there?
I was just going to say that there are, I agree with what Dr. Mathias said. There's different antibody tests. So one of the standard ones is to nucleocapsid, which doesn't therefore check the antibodies made to the vaccine. You would have to specifically get a blood test that is quantitative, tells you a specific number to the spike protein. So there are different antibody tests. You'd have to know which one you're getting. One to the spike protein would give you information about vaccine response. One to the nucleocapsid would not.
Okay, thank you. Dr. Muthaya, Jack just asked us a question. How late can you get the second dose and still be effective? So you talked about the 28 days and the 21 day, which is different between the Pfizer's 21 days, Moderna's 28 days. But what if you go 40 days or 45 or 50 days? Could you talk about that?
Sure. So again, I don't have a firm answer on how long one should wait. But we do know that people who have had certain therapies for COVID, the infection, like the monoclonal antibodies and the convalescent plasma, have received their second doses of vaccine more than 90 days after their first, after their infection. So I think that delay is okay, but I don't know exactly how long to wait.
So Jack, I think Jack's, no, I think, so that's good. I think Jack's question was, if I get the first dose of, let's say, Moderna, and then 28 days later, I'm supposed to, how long can I go before getting that booster shot? Can I go 40 days or 50 days? I mean, I know we're trying to get people scheduled, but I think people are worried about just the availability of the drugs and all of that.
I see. I'm sorry. Thank you for clarifying. The answer to that would be to get it as soon as possible, and that it is okay to wait until it is available. You don't have to start to repeat the series at any point, as far as we can tell, meaning that if you've missed that 28-day or 21-day mark, you don't have to start over again with the first dose. You just you're registered as getting that first dose, and you show up at any time that's available for your second.
Right. So for our viewers, the biggest thing is to follow what the manufacturers are saying. So if it's a Pfizer and you got the first shot of Pfizer 21 days later, you get the booster. I can tell you that there is a procedure within the medical community to notify you if you've already received the vaccine, the initial one. Hey, it's time to get the second one, and we're going to schedule to try and get you in for that. I think that's a good place to pivot to the next section of questions that we're going to have today, which is around planning and distribution of the vaccine. As the mayor, I'm getting a lot of these questions. Our public health director is on the front lines handling these questions with his staff. So I'm pleased today that we've got Ike Ogbo joining us. To Dr. Siglin and Dr. Muthaya, you're welcome to stay on, recognizing that you're also busy. If you need to drop off, that's fine. If there's certain questions here that you want to chime in about, or maybe I think, oh yeah, it'd be good to get a doctor's perspective, I may call on you for these, but more of these questions will probably be directed to Ike. So Ike, first question, it's not on here, but just real quickly explain to our viewers how the distribution of the vaccine is working, because I am getting emails, you are getting emails that say, Mayor, I have a friend who is, 45 years old, lives in Cicero and got vaccinated. In fact, everybody in Cicero has already been vaccinated, and people here in Evanston haven't. Or I have a friend that's a teacher and they got vaccinated, but I'm a teacher, and why haven't I gotten vaccinated? Or I've heard that somebody 40 got vaccinated and I'm 85. Why haven't I been vaccinated? So naturally, lots of questions that people have. Can you help us just lay out the framework of how vaccinations, the big picture, how it's working?
All right. Good day, everyone. Yes, it is quite difficult, given that we have a number of people who want to get vaccinated and they cannot get vaccinated because they don't qualify for certain priority groups. The way that it's worked is that we have conducted this in a phased approach where, of course, we have 1A, 1B, and 1C, and each of these groups have individuals who qualify. So for 1A, we have healthcare workers, those who are in our long-term care facilities, even our paramedics, and non-hospital affiliated healthcare workers. In 1B, we have our congregate homes, we have those who are 65 and above, we have our essential workers, which is of course a very vast population. And 1C are those 16 to 59 with underlying medical conditions and those who are 60 and above. Working is the local health departments that are certified receive these vaccines and they distribute them to the hospital, which might be changing going forward. As we know, the situation continues to evolve. There might be an opportunity whereby the hospitals can order supplies directly from the state. Just this week, the state started distributing vaccines to Walgreens. The city health department does not oversee this, and we're hoping to learn more. And we're hoping to also work with these pharmacies in vaccine distribution and administration. And the state, they are pushing these vaccines in order to increase the output. So that's actually how it is phased. And in Evanston, we have finished with our phase 1A, which comprises of the individuals I mentioned, and we completely advancing to 1B, where we're vaccinating our first responders, police, those who are 65 and older, but we were very specific, given the limited number of vaccines that we are getting, that we prioritize those who are the most fragile among those age groups. So we have 65 and above in 1B. So the way that we segmented it is to, first of all, vaccinate those who are 85 and above because of them being more fragile than the others. And once we are done with that, we'll move down the line. We'll do 74 to 84. After we are done with those individuals, then we'll move down to 65 and to 74. So we're hoping that the strategy that we put in place will be able to provide a system whereby we vaccinate individuals based on the quantity of vaccines that we are receiving. As it stands, we are not getting the number of vaccines that we are anticipating. They are quite limited at this point. But we are hoping that in the near future that they will increase the availability of these vaccines to us so that we can get through the process quicker.
Thank you. So a couple key points. We don't know the quantity of vaccine that we're going to get week to week as a city, and exactly when we're going to get that. That is determined by Illinois Department of Public Health. They also don't know exactly how many vaccines they're getting from the federal government. All right, so everybody's trying to figure this out. The state, like us here in Evanston, want to get needles into arms as quickly as possible. And so while initially out of the gate, it was that the state was going to distribute to certified public health departments, whether that's the county departments or city departments, they're now saying, okay, well, can we use, the pharmacies? Can we use the hospitals, North Shore Hospital, Amita St. Francis Hospital, Rush, other hospitals, and have them providing the vaccines? I think all of us would say, yeah, that makes sense. What's lacking right now is really tight sort of coordination and communication on all of this, which I know is causing some frustration for our residents when they say, hey, I heard my friend got theirs from CVS, like, why haven't I gotten mine yet? I will tell you, as the mayor, we are not in Evanston sitting on, nor will we sit on, a huge amount of vaccines. Our objective is when we get our hands on the vaccines, we are setting up points of distribution events to get these vaccines into the arms of our residents so we can get people protected and make our communities safe.
Yeah, absolutely, Mayor. What we are asking for is a much more coordinated effort because we are hearing rumors, we're hearing news in the community about people getting vaccinated here and there. And we think that a coordinated effort will definitely do us a lot of good, working with the pharmacies, of course, working with the hospitals to push out these vaccines when they become amply available. So that's what we're asking. And, we know it's going to take a little bit of time to get all the coordination figured out. But the main goal here is to vaccinate as many people as possible in a quicker means.
Yep. Thank you. And I will say, I was just on a conference call with mayors from across the United States and the Biden administration's director of intergovernmental relations, along with a senior counselor to President Biden. And I can tell you, you're seeing it in the news and everything else. We have a president that just took over 2 days ago, who he and his entire team are very, very focused on this crisis right now and are getting organized. I do expect, the number of vaccines that are distributed to increase, but it's going to take a little time for this just massive coordination and logistics effort to unfold. And I do think and that there are going to be clearly there's opportunities for it too, rooms for improvement in communication and how this is distributed. And so things are moving quickly. We'll continue to communicate with folks. Quick question we had from Dexter, who's watching, Ike. How can we find out where we are on the city's distribution list? So first off, can you tell people, and let's make sure everybody knows, how do they get onto the distribution list? And then tell us how many people have actually, submitted onto this distribution list, how that whole process works, and how they do find out where they are.
Absolutely. So first of all, you have to provide your information via a survey that is on our website. It is titled Vaccine Interest Survey, where it actually informs us that you are interested in the vaccine. On the survey, there are a number of categories that you will have to click on. For example, if you are a teacher, you click on that you are a teacher. If you work or live in Evanston, you click that you work and live in Evanston. Your age as well. So when you put in these fields in the survey, what that does for us is have us review and take a look at the data to see where you fit in. For example, if you're a 65-year-old female or male in Evanston, we know where to put you. So that means you'll qualify for 1B. So when it's your time to get vaccinated, what happens is that we will send a notification to you, let you know what day, what the venue is going to be, and you can actually register based on a registration form that we'll be sending to you. So the registration form has various slots. Usually our clinics run from 7:30 to about 3:30, where you can pick, if it's not too full, which time slots you want to come to get vaccinated. So first of all, fill out the form. Second of all, we analyze the data and put you in the group that you belong to. Thirdly, when vaccines are made available for your group, we'll be notifying you via email. For individuals who do not have email or internet, we'll be making a phone call. Once we give you the notification, we'll be sending you a registration form. You fill out that registration form, it will let you know the venue, it will let you know, have you select the time in which you want to be present at the site. And after that, you're good to go. Then when it's time for the second dose, you're also going to be getting a notification from the health department telling you, hey, you're due for your second dose. This is where you come to get your second dose. It will also provide you with a registration form where you select the time where that works for you, that is suitable for you to come to the site where you get vaccinated. And it's as simple as that.
Great. So one of the questions I'll hear people say is, well, you know what category I'm in, so why can't you tell me like when I'll be scheduled, even if it's March? Tell me, hey, March 10th, you can come in. And the reason that we are unable to do that right now is, again, getting back to that point Ike made earlier, we don't know week to week how much quantity we're going to receive, so how many doses we're going to receive, and exactly when we're going to receive it. And so that process is we have to understand how many we're getting, when we receive it, then we have to set up an event. Then Ike and his entire team have to contact those people on the priority list and say, hey, can take you in 2 days, come to this event. And so that's why we can't give a huge runway to when you're going to be scheduled. I will say this because people say, hey, well, I noticed that my pharmacy's offering it or whatever. If you can get yourself in a line at a pharmacy to get the vaccine, then go ahead and get the vaccine. We haven't put anything out as a city. I think we're going to. I just want people to be aware we are not going to have anybody knocking on doors, selling you a vaccine. Okay. There's not any mail order around here that is, you can order a vaccine. I am very worried from all my years of experience after disasters that, naturally people are nervous and anxious and they want to get the vaccine. And sadly, there are unscrupulous people out there who may try and sell you something that is not the vaccine. So make sure if you're getting the vaccine, you're getting it through a trusted source, whether it be the city of Evanston or any city, a pharmacy, or your medical professional and a doctor. Question from Gail. How much notice will the city provide prior to your vaccine appointment? This gets to the point I was just talking about. But if you could give folks a sense of how much time are we talking about? Is it 48 hours, 72 hours?
Well, it all depends, as you mentioned, Mayor, when we receive these vaccines. And one thing that I also want to mention is we do get notification from the state of how many vaccines we'll be getting. But that doesn't necessarily mean that those vaccines are in our hands. So our events are typically scheduled 3 days or 4 days after receiving these vaccines. So it doesn't really leave us with much time. So my advice would be check your emails. You might be getting an email 2 to 3 days prior to our vaccination events, just because the vaccines aren't in heavy quantities at this point. As soon as we get these vaccines, we're not sitting on these vaccines. We want these vaccines to go into the arms of our residents and those who live in Evanston. So it doesn't really give us much time. But that doesn't mean that there won't be subsequent events. So if you miss one event or for some reason you don't check your email and you're not scheduled to receive your vaccine, that would be another event in which we can schedule you for.
All right. So it's like being at an airport. You miss your flight, you catch the next flight. Okay. George asked a question, and I think this would be, this is an important question lots of people are asking. How many people are in phase 1B? And also, how many total people have completed the survey that you talked about? And for anyone that's watching, this survey and anything on vaccines at the city can be found at cityofelvanston.org /vaccine is where you can find that survey and a bunch of other information. We are going to, as the vaccinations really ramp up, we're going to do more and more of a dashboard so you can have visibility into, who's being vaccinated and who's next in the grouping list and all of that. But yeah, how many total have we received on the survey, and then how many are in 1B?
Yeah, we're hoping that the numbers will increase. Evanston is a city of 75,000 individuals, but of course we know that not everyone will qualify, given that we have children in our constituency who do not qualify for a vaccine at this point. But we're hoping to increase the numbers. So as it stands, we're close to about 40,000 entries. And keep in mind, this is not a reflection of all of those who live in Evanston. It also consists of those who work in Evanston. And we want to make this clear that we are vaccinating those who live or work in Evanston from a burden disease standpoint, where we want to vaccinate community members. because we believe that those who work in Evanston is part of the community. So we have close to about 40,000 individuals. When it comes to 1B, it is data that we're still reviewing at this point. And as you know, it is a vast number of individuals and professions in 1B. So far, I can tell you those who qualify for 1B, who are 65 and above, we have over 8,000 of those individuals. Our congregate homes, we have about 1,200 individuals there. And the congregate homes that I am mentioning are not the ones that they have this engagement with the CVS, Walgreens, like our long-term care facilities have, where they come on site and do the vaccinations. These are congregate homes that are outside that arrangement with CVS and Walgreens that will be vaccinating. Then also in this 1B group, you have the teachers, you have the daycare workers, you have the grocery store workers, you have those who work in the postal office, you have those who work in the food sector. So it's a vast number, and we're working at it every day to sort out where each person belongs. And to my very first point, when it's time for your vaccination event, you will be notified. So we're just pretty much going to go down the list, our elderly, congregate homes, and going down the list.
So we're talking over 10,000, way over probably 10,000 people are in phase 1B. And as Ike mentioned, we have over 8,000 people that have submitted that vaccination, contact form that are over the age of 65. Ike mentioned we've had over 40,000 people submit entries. I want to make it clear that Ike and his team are asking that you submit one for everyone in your household, even if they're under the age of 16. And so again, I have a 12-year-old. We submitted the form for him, even though right now there is not a vaccine for, children under the age of 16 years old. And that is, we want that information so our health department understands, what that universe looks like when we do get a vaccine that comes onto the market for children. All right, let's see if we can't hit some of these questions we haven't hit. Kenneth, Anita, Kathy all asked the question. I know it's one you and I have spoken about. How is the city prioritizing the various subgroups within phase 1B? As you mentioned, there's a lot of different groups there. So how are you thinking about tackling that?
So phase 1B, as I mentioned, is a vast group. In phase 1B, you have congregate homes, you have 65-year-old and older, and of course you have the essential workers. So the way that we devise a plan is to initially vaccinate our first responders, critical workers, those who are 85 and above, and 75 and above, and 65 and above, then congregate homes, then we'll get to the teachers and the daycare workers. So that's the way that we devise a plan. It is systematic, and we have a rationale as to why we categorize it in that way. And I think, it has been successful so far. We transition into 1B, I would say this week. We had a combined event on Monday where it was for the non-hospital affiliated workers whom we couldn't get in weeks before. We were able to get them, and we were able to also vaccinate our first responders. And today we started vaccinating our 85-year-olds and up, which to me is very exciting. And the event is going well. And we're hoping to have another event on Monday for our older adults. So everyone should stay tuned and be patient. If you do not get a notification from us, that means that your vaccination event has not come up, but you will receive one subsequently.
Ike, I mentioned earlier that I do know that the federal government is working hard to try and increase the quantity of vaccine that they can get to each state, and then the state can get down to the counties and to the cities. Just to give our audience a sense, how many doses did we receive last week, and then how many doses in total did we receive this week? I was surprised, and I'll just give you an advance warning. I know the answer to this, that I did think it would be going up. I expect that we're going to see the quantity of doses going up. That is not what happened from last week to this week. I still anticipate that to occur, although if the state and IDPH does change the sort of methods of distribution of the vaccine, then it's possible we could see reduction in the city, and we could see, thousands going to to our North Shore University Health System, to Amita St. Francis, to Erie, and to other pharmacies and so forth, and pushing residents there to get their vaccination. So I just put that caveat out there.
Absolutely. I can inform. We want to be as transparent as possible about the vaccines that we receive. We received a limited amount 2 weeks ago of 1,400 vaccines. That was 2 weeks ago. Last week, a limited supply of 900.
900. So we were down 500. Now, I will tell you, even though, again, and this is some of the disorder that's going on out there, and again, all with good intention, which is to get needles in people's arms. I was on the phone with the president of Amita St. Francis Hospital, and they had, 500, doses that they were working in the community to get out there. And so some people have said, oh, well, anyway, that should have gone to me and not somebody else. Again, the objective is we do have these priority groups. We're trying to work through these priority groups, but we're also trying to get vaccines into arms as quickly as possible here in Evanston. So, all right. So thank you for that. Regina asked a question. I think you answered it earlier. If somebody is not really on email or text, will your staff be calling them to tell them about the appointment?
Yes, that's the plan.
All right. Will all teachers, this is from Holly and Jamie, will all teachers at all levels be included in phase 1B, including university and private school teachers?
Absolutely. So the way that we are thinking, Mayor, is that we included all teachers and support staff, irrespective of whether they teach in one category. It is something that we're still thinking through. If vaccines become much available that will cover that group, there won't be any necessity to prioritize teachers. We're also thinking along the lines of if vaccines are limited to perhaps prioritize those teachers who are going to school, having in-class sessions with students because of the exposure factor. So it's something that we are still deciding. We're still taking a look at the data to see everyone who qualifies for that group. Then after that, we'll make a decision on that. We probably won't be getting to the teachers in the next week or two. But if we start to receive ample supply of vaccines, we might be getting to the teachers in week 3 or week 4. And it all depends on the availability of the vaccines. So we are gearing up for large events too, I might add, so that we can accommodate individuals if we, of course, get a large number of vaccines in Evanston. So everyone should stay tuned. We'll be sending out notifications, emails through the website, through our social media regarding status.
Okay. All right. I'm looking through the list of questions that came in, some that I feel like we've answered or Ike's answered already. I'm jumping over. So if you don't hear me call out and reference your name with a question, that's because if you've been listening, I think it's been answered. We did have a question from Joellen, who's watching on Facebook, who asked, where are the vaccine events taking place? And then I would add to her question, is the city getting prepared? Like, should, we see larger quantities of dosages come down here that we can run, and get 1,000 or more, vaccinations done a day here in Evanston, using just city resources. Again, we've got the hospitals, we've got other big entities that could be doing a good job and probably a high volume of vaccinations as well.
Yeah, absolutely. We have been engaging our community partners, entities here in Evanston, to use their sites, which are sizable and can accommodate thousands of individuals. And one being, being transparent, one being ETHS, using one of their facilities to conduct vaccinations. We used it during H1N1. I was still with the department at the time when H1N1 hit, and that was a very successful event because it accommodated thousands of individuals. We have been also talking to Northwestern to also get on board. We're going to be reviewing some of their facilities to see how conducive those facilities would be if the vaccines start to ramp up. But currently, we are utilizing a city building, Leeway Center, which is on 300 Dodge, and it has worked really well for us. So that's the only venue that we currently have. But as vaccines become more available, we have a plan in place where we might even have events simultaneously just to get through the thousands of individuals needing vaccines. And not only that, we have also been having conversations with Erie Health Center to serve as a vaccine push for us as well. So we have been making these connections. So we are prepared, and I'm preparing in the event that we will receive thousands of vaccines, hopefully in the near future.
Thank you, Ike. And I can affirm what Ike just said, because as a member of the Unified Command and the Emergency Operations Center, and we meet once a week, we do a 1 week incident period, and we meet every Wednesday. This is the number one priority, to make sure that we as a city are prepared, again, to get as many needles into arms if we get large volumes of quantities. So Ike is working very closely, and his team, with our facilities and our logistics, as well as our other partners around the city, which include the hospitals, which includes Northwestern University, which includes ETHS and our other schools, so that we have, locations ready to go should we find ourselves with a lot of vaccine. Couple questions. Lonnie asked a question: are vaccines free, or do you have to pay for them?
Free of charge.
All right, so free of charge, Lonnie. We want to get people vaccinated. Money is not going to stand in the way of that. Okay. Wavette asked a question. And this gets back to something we were talking about earlier, where things are changing and there's uncertainty still out there exactly how all the distribution is going to occur. She said, which pharmacies in Evanston will be giving shots?
So it's something that we presented to the state, and we're still seeking information as to the pharmacies in Evanston that will receive allocations, and we just don't have that information now. But we're hoping that in weeks to come we'll have that information, but it's not information we currently have.
Yeah, and I think with that, I think you're gonna, if pharmacies are going to be participating in phase 1B, I would hope that we're going to see some clear direction and communication out of IDPH, right, Illinois Department of Public Health, on that. I will tell the audience, Senator Fine, who's our state senator for this area, and I spoke for some time yesterday. She in fact just called me during the middle of this. I'll call her back, and we are talking about just that, and just trying to, again, make sure that all these different players are on the same page for how this is going to be distributed. So we know how pharmacies are going to be used, if they're going to be used, what role the cities are going to be playing when you have a certified health department like Evanston. So next question, and I appreciate this because I've heard this from lots of other friends and colleagues who live up the North Shore, who live in Wilmette or Glencoe or Winnetka or Kenilworth, are asking, I don't live in Evanston. I live nearby, not in Skokie, where they have their own certified health department, but let's just say I live in Wilmette. Can I be vaccinated in Evanston? I know that's a question you've gotten, Ike, so could you share that with folks that are watching that aren't Evanston residents and don't work in Evanston?
Right. So as you mentioned, Mayor, Skokie has its own health department, and they're vaccinating their residents. We have a certified health department. We're vaccinating our residents and those who live here. Cook County Health Department covers the Cook County jurisdictions. So those individuals will be vaccinated by Cook County. But the plan moving forward is if we increase the number of vaccines in Evanston, and if we get those who live in Evanston vaccinated and those who also work in Evanston, that we will definitely vaccinate our neighbors. There won't be any reason why we wouldn't if we have those vaccines available. So that's the plan going forward, but that's all the way down in the future. That we will, that like we did with H1N1, we had people from Niles, from Wilmette, from Kenilworth, come to our events to get vaccinated. But we want to make sure that we handle our residents first and those who work in Evanston.
Right. What I would tell you, Paul, again, is that is exactly the plan. If we can get our hands on enough quantity of vaccine, we're going to vaccinate everybody that lives in Evanston, works in Evanston, and then we will use our health department and other resources that we have here to help vaccinate neighbors in Wilmette, Winnetka, Glenview, Glencoe, whatever, up the shore. The objective is to try to get everybody. Right now, those cities are under the Cook County Department of Health, because you don't have your own certified health department, is where it falls. But again, we want to be a good partner with the county as well and help once we've achieved our first mission, which is making sure everybody that works and lives in Evanston is vaccinated. I had a question here from Elizabeth. When your turn comes up to receive the vaccine, is there any flexibility as to the date and time? I mean, literally, you're going to get this notice and you could be out of the area or have another appointment at that time. How does that work, Ike?
Yeah, absolutely. If you're not able to attend an event that you have been scheduled for, there will be multiple and several events that down the line we can get you in at the next event. So that the way that it will be structured, it might not be the event for the particular group that you that you qualify for, but we will still get you in, even if it's, for example, if you're 65 and older and we're done with that group, and you go, oh, I didn't get vaccinated, and we're working in the group with teachers, we'll definitely fit you in that group. So that's the way it will work.
Okay. All right. So if you can't make the appointment, we will try to work hard to get you in the next appointment because you're certainly within the priority group at that point in time. Sarah asked a question on Facebook Live. Can Evanston residents be vaccinated elsewhere?
Well, that's a possibility that they can be vaccinated elsewhere. I know for a fact that I was contacted by Cook County about our Evanston residents registering in Cook County. They want us, given that we are a certified health department, to vaccinate our residents. But there's a possibility, especially right now that vaccines are being pushed to pharmacies, that you might have an opportunity to get vaccinated somewhere. But because vaccines at this point are limited, I think various jurisdictions and various health departments are vaccinating their own folks, the same way we're vaccinating our own folks and people who are living in Evanston. But it's an ever-evolving situation. There might be an opportunity in the future, or even probably now, where you can get vaccinated elsewhere.
I think that's really interesting what you shared. I mean, there's nothing that says Sarah or any of us couldn't also complete that form that Cook County has, but just realize the people that are analyzing that data say, oh, well, Steve and Sarah, they live in Evanston. Like, we're not gonna vaccinate them. So you may never hear back necessarily for them. But again, people are anxious, and understandably so, to get the vaccine. And so, wanting to, if there's other means to get the vaccine, again, as long as you are confident that is a legitimate vaccine. Again, I just want to stress, I worry about unscrupulous people out there selling, fake vaccines. So make sure it's with a trusted resource, your doctor, your pharmacy, your city.
Right. And also, Mayor, one thing to add, as information reaches us, we will, of course, communicate that to the masses. Once we get a hold of the information about maybe Walgreens, CVS, and these pharmacies pushing out vaccines, please look out on our website, via social media. We'll be sending out that information as well. We want to, the state wants to, we want to create as many avenues as possible to push these vaccines so that our masses can get vaccinated.
We had a question from Alan. Do you put the second dose aside or assume that the required second dose will be sent in time? How does it all work with the second dose, Ike?
Absolutely. So it's worked in a way where we have been receiving those vaccines. For example, we do have vaccines available for the second dose. So it is something that we have worked out, that we have those vaccines available for those who are going to be taking the vaccines, even maybe not getting the vaccines from the state. So for example, the people who got vaccinated at our first vaccination event, which was January 31st, are due for their second dose come next week. So what we've also strategized is to set those doses aside so those individuals can be vaccinated next week. So going forward, that is a strategy that we put in place. We want to put this in place so that we have those vaccines available and not have to wait on the state to provide those vaccines for the second dose, because we don't know in which way or angle the state is going to go with providing those vaccines.
Okay. Ike, we have a lot more questions from residents, and I think that this has been a great conversation today. There's been a lot of engagement on Facebook with the questions that people are asking. I also know that we are doing an event right now that you, as the head of the health department, are overseeing at one of our community centers that's vaccinating 550 of our older residents today, age 85 or older, which is very exciting. So what I am going to suggest is that Patrick Degnan, big shout out to Patrick and Anderson Castillo, who are behind the scenes. You don't see them on here, but they are the ones that actually put this on. If they will get with Ike Ogbo and decide whether we should have another coronavirus Q&A focused again on vaccinations within the next week or two, and we can answer additional questions and share more information. As you've hopefully learned today, the goal is the same. How we're going to achieve the goal of getting everyone vaccinated is changing. And we were initially told as a city that we would get all of the vaccine and then we would decide how it's distributed, how many doses the hospitals are getting and others are getting. That hasn't really played out that way. And I can't really blame, IDPH and the governor, who are also focused on just getting as many Illinoisans vaccinated. So I am just asking everyone to please, have faith. Please remain patient. Please know that we are blessed here in Evanston, really to have an outstanding public health director in Ike Ogbo, who I have the privilege to work with every day. And I will tell you, this man is working 24/7 for us and has built a great team. There are a lot of people that are working on this, and we will continue to communicate as quickly as we can and have reliable information on how the vaccination process will be working. But hopefully today we provided more information to you so you have a better understanding, and you have my word, we will do this again so we can answer additional questions. So thank you for tuning in. Thank you, Ike, for being with us. Thank you, Dr. Muthaya and Dr. Siglin for joining us today and answering questions up at the front. Be well, everyone, and we will see you later. Thank you.
Thank you.